So joining us today is Professor J. Battacharya from Stanford University. Jay is a professor of medicine and has long argued against lockdowns as a response to the pandemic. Along with Sunetra, Gupta and Professor Martin Kulldorff, Jay was an author of the Great Barrington Declaration, which argued for focused protection of vulnerable people who are vulnerable to COVID. But since that was published, the three have been subjected to slander, vilification, criticism and censorship, which has led for you to set up a new Academy of Science and Freedom to allow the free exchange of scientific ideas. And I'd really like to explore why you feel that was necessary to do.
So I think the mission of this new Academy of Science and Freedom, I set it up with Martin Kulldorff and Scott Atlas, who was a friend of mine from Stanford University, was an advisor to President Trump on COVID policy. The idea is that, the motivation is that science itself, I think, has, in some ways, though, it's performed quite well. It's also, the basis of it is performed quite poorly. The basis of it is free discussion among scientists, tempered by data, with a spirit of trying to learn. It's a spirit of humility, maybe even. Instead, what we've seen is the corruption of science, where the people like central funders of science working very hard to take their ideas and exclude any scientists who disagree, even and throw them out to the fringe, to prevent the possibility of dissent within science, to smear scientists.
Have you ever seen anything like that before?
Not in my career. I mean, I'm sure, there's episodes in scientific history I can go back. Like there's in the Soviet Union, there was a scientist named Lysenko, who was Stalin's favorite scientist, who he was convinced that Mendelian genetics was false, and so he systematically excluded a whole generation of Soviet biologists. Many got sent to Siberia or wherever, and I mean, I think it led to famines in the Soviet Union because their biology was so. I mean, those kinds of sort of central control of science is just bad for science. And so one of the missions of the Academy of Science and Freedom is to restore the norm of free discussion within science. Yeah,
and how's it going?
So we're just starting out, really.
Yeah.
We've had a few interesting sessions and conferences, but we want to turn this into include a lot more people in this, and I'm really excited about that.
Yes.
Actually, can I tell you about the second mission, because I think it's as important. The voices at the table during the lockdown were so limited. If you were a scientist, it was not all scientists. Only scientists that were invited to the table were epidemiologists, immunologists, and virologists. That is too narrow a basis for which to design policy that affect billions of people. You actually needed other people with other expertise at the table. You actually did need economists. You needed artists. You needed philosophers. You needed a vast array of expertise with voices at the table to decide what to do. The place of science is never to dictate policy. The place of science is to inform policy. And so the second mission of the Academy is to restore science as a trusted advisor for policy rather than a replacement for policymaking, which is what happened during the pandemic.
Well, it was argued that politicians were making the case for the economy and trying to balance the harms, of child development and mental health, and that was what. And I think a lot of the modelers thought that was being done by politicians. Do you not think it was?
No, I don't think so. I think those voices were systematically excluded. Like in the early days of the pandemic, I wrote an op-ed arguing that we didn't know how deadly the disease was. I have a PhD in economics, and I was accused by my colleagues of valuing money over people, even though I said not one word in the op-ed about money. I just said we don't know how deadly the disease is, and I called for studies to evaluate it. I think the moral panic that ensued in the early days of the pandemic excluded anyone who didn't have an epidemiology, virology, or immunology background from a voice at the table, and that was it was just a mistake. Like they're bright people. They know a lot about their respective fields, but they don't have enough wisdom to order the whole world.
No. Okay. So it was sort of run on modelling, really, and the fear of what might happen based on assumptions that were basically sort of guesswork.
Yeah, and a blindness to the harms of the policies that it's adopted, right? So a monomania aimed at suppressing COVID, not understanding that there are a myriad of other goals that people have that are quite legitimate, including health goals, that should have been accounted for.
How do we distinguish what deaths were due to COVID and what deaths were due to our measures, you know, the COVID countermeasures, you know, the neglect in the nursing homes, the sort of loneliness, which is deadly? How can we ever know? Because we have, you know, when you look across the piece in 5 years' time or 2 years' time even, we won't know what, the lines are blurred, aren't they?
Yeah, well, I mean, I think the question isn't how many people died of COVID. I mean, a lot. The answer is a lot of people died of COVID. The question is how many lives were saved on the margin by our measures. And for that, I think what you need to do is you need to compare places that had different policies put in place.
There's not many though.
But you had enough.
So we had South Dakota.
You had Sweden, you had Florida, you know, you also had the other extreme. You had places like Peru, which implemented one of the harshest lockdowns in the world, and yet had I think the highest per capita death rate in COVID, or if not the highest, very close to the highest in the world. So you have a range of policy interventions. You have a range of outcomes. Honest assessment of these outcomes, where you look at the data and try to correct for errors in collection and all that. I mean, I think that's already happening. For the most part, I think those kinds of comparisons are concluding that the lockdowns didn't save very many lives.
It didn't save very many. Well, you couldn't even put a number on it, I don't suppose. I
mean, if I had to put a number, I'd say 0. But you
really?
know, yeah.
Because you're on a net gain, net loss.
Yeah. Well, no, I think the lockdowns on net over the whole period of the thing.
Yeah.
I mean, you could make an argument for places like New Zealand that they delayed until the vaccine. It might have saved lives there.
Yes.
But for in the U.S. or the U.K. or places that didn't have the possibility of being a small island nation, in the South Pacific, I mean, I don't think the lockdown saved very many lives. Because what happened was, even the rhetoric of the lockdowns, okay, let's flatten the curve, that doesn't mean getting rid of the disease. It means pushing off the disease until later. Well, later happened pretty soon. But
then later happened pretty soon, but we had vaccines and we had drugs, so it may have helped in the interim. But
could have. I mean, it's complicated, right?
It is complicated.
Yeah, because I think the lockdowns by May of 2020 had already failed in the UK, and like there was, it had pushed off the compliance with the lockdowns. It was not possible for most of the country who aren't rich to comply with the lockdowns for 2 years or even a year. So I think if you do the comparisons of like the short-term benefits of lockdowns in terms of saving lives, you're still finding pretty close to 0.
Yeah,
that's what the results of these.
And we don't know how many people lives have shortened. Yeah.
Yeah, right. But the harms, of course, I think are
becoming more and more clear by the day. So it was a year ago since we last talked to you on Sketch Notes. I'm just going to ask, were you right all along?
I mean, I think the strategy of focused protection that we proposed in the Great Barrington Declaration, the idea of acknowledging who was truly at risk, and then also acknowledging the harms of the policy, the lockdown policy on less vulnerable people, that strategy was the right strategy. And it's, if you look at what's happened around the world in the years since we last talked, we've seen place after place adopt that strategy.
But people argue that you couldn't really adopt it before vaccines because you can't draw a line down the middle of a population. Children are visiting or seeing grandparents, people mix, so you couldn't really have done that. Yeah,
I think it was harder without vaccines. That's absolutely true. But I don't think it's impossible. I think that the idea that it was impossible was itself an enormous mistake on the part of public health. implementation of the idea of focused protection would have been a local thing. You have to account for the local living circumstances of the set of people you're trying to protect. So focused protection would have meant something very different in nursing homes and care homes than it would have meant for elderly people living alone in a one bedroom flat. It would have meant something very different for people living in multi-generational homes. In fact, what happened was that public health adopted this idea of lockdown, thinking that it would protect the elderly, right? They had this idea in their mind that we just keep people apart and the disease will stop spreading. But in fact, the disease spread anyways.
But forgive me, it wasn't just elderly people who are vulnerable, for one thing, and also you say that you could have had focused protection for people in multi-generational houses, but how? Yeah,
so for instance, for elderly people living alone, you could have organized free food deliveries, right? Instead of like requiring them to go out, or many older people, they were essential workers. In the United States, there's no sabbatical leave, there's no paid sick leave really so we just asked essential older people to go out and work. For people living in multi-generational homes, it's a harder problem, but we could have used the resources that we used to protect less vulnerable people and instead. So for instance, in places like LA, Los Angeles, you could have offered hotel rooms, made them available for when your grandson comes home and says, or calls and says, "Grandma, I think I've been exposed." Grandma calls public health. Public health says, "Oh, you can stay at the hotel for 3 or 4 nights until you know your grandson's negative."
I mean, the problem was the asymptomatic transmission, wasn't it? So the grandchild would not necessarily. It would
have been more difficult. But if they go in and say, "Okay, I went out to a party.
Yeah.
I'm exposed. I might have been exposed."
School.
Or well, even school. So like the school actually, funny enough, especially during the first year, was not a primary source of transmission.
No.
I mean, if you look at the evidence out of Sweden that kept schools open the entire time, schools reflected the community transmission rather than drove it.
But I don't want to go diving in too hard and criticising. But I'm saying, well, we didn't know that then. And it was, because we had only known flu, we thought that children would be potentially transmitting, but we later found out that they were not drivers. That was
October 2020, we knew that.
We knew then.
Yeah,
okay, so that's important.
Because there were papers published by the Swedish Public Health Agency.
Yes.
About the relative safety of keeping schools open. Mm-hmm. Safety even for the teachers who actually worked in these schools with no distancing, no masks. There are kids up to age 15. Yeah. And they actually had COVID at lower rates than other workers in the community.
Yeah.
So I mean, I think it's an excuse. Like, would it have been perfect? It obviously couldn't have been perfect. You're absolutely right about that, Lucy. But on the other hand, the idea that lockdown would protect the elderly, we've seen that was a failure, an utter failure. 80% of the deaths, something on that order, have been in people over 65. The premise that lockdowns could work to stop community spread was false from the very beginning, because societies that we live in are unequal. They don't. The set of people who could actually abide by and happily thrive in lockdown are actually a relatively small subset of the population, relatively well off with jobs that can be replaced with work from home without any harm. That's a relatively small part of the population.
Do you think that's one of the reasons why it persisted, the idea that lockdowns, there was no one really with a strong voice to fight against, but the sort of work from home classes were people with a stronger voice and perhaps weren't suffering?
The lockdowns were caused by technology. Zoom caused the lockdowns, right? So if you ask why didn't lockdowns happen in 2009? We had like Skype, which was not nearly as good as you couldn't have replaced work with Zoom in 2009 during the H1N1 epidemic. The availability of the technology to have essentially the upper class of workers replace work with work from home permitted the lockdowns to happen and politically enabled the lockdowns to continue for as long as they did. Because people weren't thinking about the rest of the society that actually couldn't replace the jobs with work from home, the working class, the poor, the vulnerable.
But you say that, the deaths, we saw them in the elderly anyway, and lockdowns didn't work, and we saw that, they didn't stop transmissions and deaths, but wasn't the idea, we had two things, either to eradicate the disease or to squash the sombrero or flatten the curve. I mean, those were the two things. I mean, there's not really, do we have good evidence that they didn't do either? Well, they didn't.
Well, yeah, it's like, I mean, I think the idea of eradication was dead in January 2020. So when the disease was, it was already in China, obviously. There were cases in Iran, there were cases in Italy. The disease was already spread around. And there's zoonotic transmission of the disease that we already knew about in January 2020.
From animals, yeah.
And so this is not a disease that is amenable to eradication. 80% of white-tailed deer in the United States have antibodies to COVID.
So do you think people who supported zero COVID or wanted eradication still feel the same now when we see, I mean, what do you think of Shanghai? What's happening now?
Yeah, I think it's a demonstration of the folly of zero COVID, right? They have destroyed their community life, the economic life, they've starved their people, and to what end? The disease is not gone, it's going to come back. The idea that we can somehow, with lockdown, eradicate the disease is absolute folly, and was folly from the very beginning. It was never feasible to do that.
So the last time we spoke, you had been subjected to sort of something of a campaign against you, a hate campaign. Can you tell me how that ended? What happened?
Well, so the last year has been interesting. I mean, I think it's one of these things where, like, if we had been obviously wrong, that lockdown worked to, suppress the disease down to really low levels, and we came out of it without any problems, and I think that I would have been forgiven, right? It was like I was just did a hypothesis, but the fact that we were right made it's put huge parts of the scientific community and the public health officials and many politicians in a difficult place because they made the wrong call. And so no one wants to admit that they were wrong, obviously. I mean, I don't, as a scientist, you have to admit you're wrong sometimes. That's just when the evidence goes against you. That's part of being a scientist. But when you make a consequential call like this for a lockdown that has harmed the lives of a billion people, or more, you can't. I mean, it's just very difficult to say, "Oh, oops, I'm sorry." And I think the last year has been interesting. I think the public has turned very sharply in the direction of ideas like the Great Barrington Declaration. In the UK, you had Freedom Day happen in August, and it stuck. I think there's been push from scientists like in Ice Age and elsewhere to try to go back, but it just hasn't resonated with the public. In state after state in the United States, that's happened. Countries around the world have started to move in this direction of, okay, we can't get rid of the disease. I mean, so we have to come to terms with how do we deal with it, and it can't be this continual oppression of where we center our community life around suppression of it. And so what's happened to me personally is it's been gratifying to see the public turn in the right direction. Same time, there's still this like underlying sort of bitterness and unhappiness in parts of the public health community. I don't know. We'll see what happens with that. I don't care so much about that these days.
Yeah, there were posters or something, weren't there?
Yeah, there was a campaign on campus. So there's some. we'll see what happens on campus. I mean, some of my old friends have started to reach out to me. We'll see.
Have they?
Yeah.
Yeah. So things are turning.
I hope so.
Yeah. It must have taken a toll on you, did it?
It was stressful. It was really stressful. I mean, when I signed the declaration, I mean, I knew I was going to ruffle feathers. I just didn't understand the extent to which the feathers would get ruffled. I had already been through a lot of stress from my earlier work on COVID, and so it's not that I went into the Great Barrington Declaration. I knew what was going to happen.
Yeah.
There's been compensation, Lucy. I've got to know lots of interesting people that I never otherwise would have met. It's been an adventure of a lifetime for me. Yes.
Well, I mean, indeed, Francis Collins, the head of the National Institute of Health in America, actually wrote to Anthony Fauci arguing or calling the GBD, the Great Barrington authors, fringe epidemiologists. And he called for a devastating takedown of GBD and a suggestion that Fauci said was an excellent idea. So did you feel that you were up against the full force of the state?
Yeah, so that email that Francis Collins wrote, the head of the National Institute of Health, who controls $45 billion of funding and the careers of countless scientists in biomedicine in the United States, he wrote that email to Tony Fauci 4 days after we wrote the declaration. We published it on October 4th. Tens of thousands of scientists signed it. Hundreds of thousands of regular people signed it. And 4 days later, you have the head of the NIH writing the head of the National Institute of Allergy and Infectious Disease calling for a devastating takedown. You have to ask why. Like, why did they view this document as such a threat? It's very simple. It's the argument that lockdown was the scientific consensus was central to their ability to implement the policy in the first place, because it's absolutely extraordinary policy, unprecedented in scope in human history. I think if it's not true that there's a consensus of science in favor of it, then what are they doing? Why aren't they allowing this debate to happen? Why are we just jump into this policy without a discussion, really? And so to them, the GBD threatened this illusion of consensus, and they had to fix that problem, right? So Jeremy Farrar in the UK wrote in his book Spike that he talked with Dominic Cummings, I guess was Boris Johnson's advisor, organized a propaganda campaign, especially against Sunetra Gupta.
Yes. Here
in the UK, and she still tells me about the scars from that.
Yeah.
I think what it shows is that the most powerful movers in the scientific community and the policy community viewed us as a threat because we shattered the idea the idea was that there's no reasonable scientist against it, and that was never true. There was deep concern about lockdowns, the harms they cause, and the ability to actually address the pandemic throughout the scientific community. And people stayed quiet because they're afraid for their careers and for various other reasons. We shattered that consensus, shattered the illusion of that consensus, and that's why he wrote that email. What
influence did our policies have on the rest of the world?
The question is, like, why did we adopt lockdowns? Why did country after country after country adopt lockdowns? Is a really interesting one. Of course, there are exceptions, like there's Sweden, right? Or in the United States, there's Florida and a few other states that didn't go down this lockdown path. The influence that the example of China had was absolutely enormous in convincing countries to adopt lockdown. Countries looked at the Chinese response in January 2020, where they locked down, and it looked like they'd conquered the disease. And then they compared it against Italy, which hadn't locked down. That was seeing a severe outbreak with huge numbers of deaths in a very short period of time in their elderly population. And they're like, oh wait, Italy didn't lock down, China did. China solved the disease. Let's lock down. That played an enormous role in thinking. The other thing was the modeling that you suggested. So there was a model out of the Imperial College London by Neil Ferguson. The modeling suggested that in the UK, if there was no lockdown, 500,000 people would die within months. In the United States, 2 million people would die within months for the disease.
Did they model that? Is Neil Ferguson modelled for other countries?
Yeah, for the US and the UK.
Okay.
He did Sweden too, but all these models were vastly off. Like, they were just wrong on, there weren't going to be 2 million deaths in 2-3 months in the United States if you didn't lock down. The models have built into them the assumption that lockdowns will work.
Yeah. And
so therefore you can't go on the other end and say, well, therefore the models say that we should lock down, because you assumed that they would work. You have to have evidence. And it's very difficult if you're a politician. You're getting advice from top-level bureaucrats and scientists telling you, look, if you don't lock down, millions of people are going to die. To say, well, look, I don't know that the evidence is good enough to warrant that. It's an extraordinary intervention. It's just much safer to say, well, I did what my scientist advisors told me to do, if you're a politician. I think that is the dynamic that played out in country after country after country.
So you were sort of, Francis Collins and Fauci tried to sort of take you down, but what about the role of big tech as well in perpetuating this idea?
Yeah, so a lot of the government agencies, I think in the US, the UK, and Canada, other places, they played an enormously important role in how big tech treated dissent during the pandemic. Right? So when we published the Great Barrington Declaration, Google in many countries push the ranking of the declaration below the second page. So if you typed in Great Barrington Declaration, you'd see 15 stories criticizing us on the front page, and then you have to like click down to the second page to actually see the site itself. Facebook censored us, took down our page for a week.
Did they? What? Just the Great Barrington Declaration?
Yeah, the Great Barrington Declaration site got pulled down for a week. On Twitter, there was Martin Kulldorff was actually censored off of Twitter for like almost 2 or 3 weeks until he like removed some offending text that he put in. Big tech worked very closely with governments to implement.
Do we know that?
I don't know that for a fact, but it would defy any imagine. Like it would. So I'll give you an example of what we do know. There was an email from Mark Zuckerberg, who's the head of Facebook, to Tony Fauci in the early days of the pandemic, offering to cooperate. In the U.S., there was this new disinformation board that they were going to form I call it the U.S. Ministry of Truth, and there was in the documents that were proposing to develop it, they had as a part of the plan cooperation with big tech to suppress COVID misinformation.
Who was behind that?
The Biden administration was.
Oh, the Biden administration. Oh, okay.
Yeah.
So it was a joint effort.
Yeah.
And understandably, they didn't want to get told off for putting out the wrong information, and so people get caught up in the net of. Or do you think people are targeted, people who are high profile like Martin, or do you think it's a matter of an algorithm just seeing certain keywords and taking people out?
I think it's probably both. I mean, so I mentioned Jeremy Ferrara working with Dominic Cummings, which he admitted in his book Spike. I mean, what they were talking about essentially was a propaganda campaign. It would shock me if big tech wasn't involved.
Yeah.
Certainly, big media was involved.
Yeah. I mean, it sort of makes you worry about how wide that could go beyond public health. Do you think there's implications for everything, really?
No, it's actually quite scary, right? So, like the ability for big government to use big tech and media and its media influences to destroy critics, to devastating takedown of critics of its policies, is a big challenge for democracies. Right? The way democracies function, you have to allow dissent, even if it's uncomfortable for the government to have that dissent happen. During the pandemic, they had a ready excuse: oh, well, any dissent is bad for public health. But you have a situation where you don't know what the science is saying. You don't know what's good for public health. The moral basis for saying you shouldn't go against public health advice is that public health is based on good science. If I say that smoking is bad for you or good for you, I've committed a sin, right? I in my position as a professor at Stanford, should never be saying that, right? But that's because the science on smoking is so solid that it's a sin. Whereas the science on are lockdowns the right way to deal with COVID, there was no good science on that.
Yeah.
I mean, so to jump from, oh, we know this, any dissent is a sin is actually itself sinful. I think it was a disaster. I think for democracy. And if we allow that to continue as in liberal democracies, it'll be, I think, a real challenge.
Yeah, yeah. So. I mean, that comes to, the next point. Do you think these lockdowns have set a dangerous precedent for pandemic policy in the future? Or do you think we're at a place now we can see the damage and, have the sort of important policymakers, do you think they've realised and would not do it again? Or do you think no one's really admitted the mistakes?
I don't think anyone's admitted the mistakes as yet. I think that it's an open question whether, and it's something that I want to have a role in fighting over the next few years, is when we do an honest assessment. Like in the UK, you have a commission, right? I think it's supposed to be done in 2025 or something. Yeah. Evaluating the response. I think that needs to have a very wide set of voices. Unlike during the policymaking during the pandemic, it needs to include the critics. And it can't be run by the people who ran the policies themselves that have conflict of interest in sort of concluding that they did everything right when they very clearly didn't. And I think if we don't have that, there will be another respiratory pandemic in the future at some point, and there will be lockdowns in the future. We have to make an affirmative choice to never lock down again as a way to deal with a respiratory pandemic. Or
whatever the agent, whatever the virus.
Yeah, I mean, I think the set of people that are vulnerable will differ in whatever future respiratory. This one we got, in some ways, we got extremely lucky that there was this 1,000-fold difference in risk for the old to the young.
Yes.
But the strategy should be always, like, let's figure out who's the most vulnerable, devote resources to protecting them, and the relatively less vulnerable need to keep society going. Because the harm from stopping society is so great.
I mean, is there always, for example, in the Spanish flu, it pretty much hit everyone, didn't it?
It had this bimodal. It hit old, but it also hit many young people too, and that was quite devastating. I mean, it was right at the end of World War I.
Yeah.
They actually tried lockdowns in some cities for short periods of time. Did nothing. They tried masks again. Did nothing. They didn't understand really how the disease spread, and it was a tough time for the world. Right, the world was much more poor then.
So that may have been, we had a more vulnerable population. We can't really expect, we don't know what.
Yeah, so it's a little hard. I mean, trying to draw lessons from the 1918 response is not appropriate. I mean, in the modern world, the key thing is identify the vulnerable.
Yeah.
And we have science now that can actually relatively quickly, apparently, develop vaccines, develop treatments. If we remove the politics out of it, apply just common sense thinking with these amazing scientific advances, I think we could do much better with the next pandemic. Just have to say no to lockdowns.
Categorically.
Yeah.
What damage do you think they've done, and how long do you think that might last?
I mean, it's a disaster. So for young people, millions. I think it's an estimate like a billion or more kids, school kids around the world, have missed up to 2 years of school. The evidence on the effect of that is that throughout their lives, they will be poorer, they will be less healthy, and they will live shorter lives as a consequence of just even short periods of schooling being missed. That's the damage that these billion and more kids are going to pay throughout their lives. And it's not just poor kids, but it's not just kids, but poor kids that paid the cost differentially.
Yeah.
So it's if you worry about inequality, this is the biggest driver of inequality in peacetime history.
Yeah.
As far as a single policy is concerned, the working class, the small business owners, it's devastated their livelihoods. It's harmed mental health in catastrophic ways. 1 in 4 young adults seriously considered suicide in June of 2020 in the United States, according to a CDC study, and that's just intensified.
What was it like before? Was that?
It's like 4 or 5%.
Right, increase.
I mean, no, it was like a 4 or 5 times increase in the suicidality among young adults. For young people, for both their mental health and even for the physical health, like we stopped doing cancer screening. In the UK, there's this massive backlog of cases of people with heart disease that are not being treated. You have sort of the focus on one infectious disease as the only threat to human health was so short-sighted because it put aside all of these other priorities in public health that are quite important for human health. And I think in country after country, we're going to have this overhang of problems caused to health caused by lockdown that'll last a very long time.
Of course, our government would argue that they never put aside other public health problems, and that if you had a lump or concerns, you would still be able to and should have gone to a doctor. So they would argue lockdowns didn't cause this backlog, but it was people who decided not to go. And but that's.
But Lucy, the thing is, it's like they had a specific policy to create fear, right? You had SAGE in the UK. With this like SPIB, this behavioral subunit, and they had they adopted a policy to nudge the public into fear. What do they think that was going to be the consequence of that? In the United States, this explicit adoption of fear as a technique to control populations I mean, it wasn't explicit. It was implicit. But it was very clearly that was the idea. In Australia, they put in, like once upon a time, they used to do these TV commercials with your lungs would fill with black soot if you smoked, right, and to scare people into not smoking. Well, they did that with COVID. They showed an attractive young woman sitting with a ventilator in a hospital bed, saying this could be you. When in fact, that's a very rare outcome for young people if they get COVID. They used fear-based messaging to control people. And what did they think was going to be the consequence? That people would happily go to the hospital thinking that they were going to go, get COVID and die, even though they had a heart attack and died from the heart attack instead.
Yeah. A
huge increase in deaths at home from heart attacks.
So public health should not be about fear-based messaging.
I mean, it's unethical what we did.
Yeah. So do you think there should be a new Great Barrington Declaration or an equivalent?
I think I only have one declaration in me in my lifetime, but I do think that the ideas, the funny thing about the Great Barrington Declaration is that it's not new. It's the old pandemic plan.
Yeah.
It's the kind of pandemic plan that we followed successfully in pandemic after pandemic after pandemic, respiratory pandemic after pandemic. So I don't think you need a new one. We just need to like a refounding of the principles of pandemic management on the old basis. With the modern technologies to update how we can do things. I mean, I think the principles are simple. If you identify the vulnerable, you do it as quickly as you can. You develop treatments and cures as rapidly and on a science, good science basis with randomized studies, and you don't disrupt society. You disrupt it as little as you can, because that disruption is itself a public health harm.
Yeah. I mean, you mentioned that you went to see Donald Trump, did you, to try and talk about the policy, and what was that about? And do you think, people have changed their minds now? But what was that conversation?
So in August of 2020, my colleague at Stanford was named Scott Atlas. He was the advisor to Donald Trump on science policy, and he invited me and Martin Kulldorff and a couple others to the White House to talk with President Trump. It was an honor of a lifetime. It's not something I normally get to go do. So when I met with him, I'd written this long document about the safety of opening schools and the relative low harm to children from COVID relative to the harm posed by closing schools. So that's the main thing I shared with him, like opening schools and the protection of the vulnerable. Those are the two major ideas, especially older people, nursing homes, and so on. He was very concerned, President Trump, about that he had locked the world down in March of 2020 on the advice of Tony Fauci and Deborah Birx, and also, it turns out, Neil Ferguson. He mentioned to me, he said, "Look, I shut the economy down, and I was told that if I didn't do it, 2 million people would die next few months." And he asked me, did he save 2 million lives? And I had to tell him no. I mean, it was really hard to tell a president no to that, because it's such a consequential decision. But the model on which it was based was not true. 2 million people were not going to die if we didn't lock down. If we'd instead adopted a policy of focused protection, we would have had a much better outcome. Because who died during the first wave? It was older people.
Older people, yeah. And
in fact, I say more than this. Like the idea of the lockdown protecting old people itself killed people, right? So why did, in New York, for instance, Andrew Cuomo send COVID-infected patients back to nursing homes? He's not a cruel man. He wasn't. They were in a hospital. What he wanted to do, they did it here too, right?
Did the same thing.
Did it in many places. The idea was the hospitals were the place where the scarce resource was. We need to open hospital beds. That's the wrong idea. The right scarce resource was protection of the vulnerable. So they send COVID-infected patients back to nursing homes, exposing the vulnerable, because they didn't have as a central tenet of their public health policy making the protection of the vulnerable. Instead, it was protection of hospital systems.
Yeah.
If you aim at the wrong goal, you're going to get a bad outcome.
Very well put. So, do you think that the tech companies and the World Health Organization have too much power in individual governments?
I mean, I think that's a challenge broader than just public health and maybe outside of my pay grade. But I do think that competition in big tech, less like more neutral application of power by governments in regulating big tech, less control by governments over media outlets, or at least some return to some semblance of neutrality. Like, I think what happened is essentially a propaganda war, with and big tech has this. There is also this like sort of plus side, right? We did actually finally get our message out. Through on the side at the cost of being smeared and things, but we actually did. I mean, I think it resonated with the people. So you do have this like these outlets, but it should be built into our system
rather than the fight. So
right.
Yeah, things like Substack.
Oh, so I'm not actually on Substack, no, but I do admire the company. Yeah, because what they actually permitted dissident voices to speak. Unlike Twitter, where every tweet you're worried that some 20-year-old intern is going to suppress you because they don't agree with your scientific analysis or something. I think like the existence of things like Substack permitted other some dissident voices to be heard. On the other hand, it's like the central places in big tech where these kinds of policies get hashed out, places like Twitter, like Facebook, Google. I mean, those were suppressed. Like, those dissident voices were suppressed. People were thrown off the platforms. Essentially, what happens is it's not so much that you get thrown off the platform, which is bad enough because you lose the audience, but that it's like it's a ding on your social credit score. Right? It's a de facto social credit score. Oh, these people are on the outside. They're on the fringe. It's a way to suppress dissident voices without actually having to make an argument.
Yeah. Which, do you feel like you were, I mean, did people deliberately target you?
There's no question about that, yeah. I mean, I joined Twitter in September 2021. For years, I figured I didn't need to be on Twitter. I'm a scientist. I just publish articles, and that's how I speak. I found Twitter actually, it's been interesting because I've managed to get a lot of my message out, but I'm not going to say everything I believe, because if I don't want to get on the wrong side of the censors. I'll say everything I say I believe, but I can't say everything I believe on Twitter.
I mean, it could be argued that we had to have everyone agreeing to behave in a certain way to sort of slow down the spread of the virus. So if we'd had different scientists calling for different things, it would have been very confusing for a public, and we may not have got much obedience, and we may have had a worse outcome. So there could have been an argument for having a kind of uniform message, which the World Health Organization, I think, tried to put forward. Do you agree with that?
Yeah, I mean, I think we talked earlier a little bit about this. The moral basis for unanimity messaging is solid science. Right? If public health is not built on solid science, then it has no moral basis for demanding unanimity of messaging. On the other hand, the norms in science itself involve dissent, involve disagreement.
But we were in an emergency and people were going to die. We didn't know how many people would die. We needed to do something.
What we needed to do was good science. That's the solution in that situation. Right? If you rush ahead and say, well, I know what science is going to say, let's do this right now, and then if get rid of all dissent, then you'll never get the good science to actually figure out what the right thing to do is.
But people would argue we have no, well, yes, you've overcome, no alternative to lockdowns, you've given it, and actually the trials, they never really looked at how effective the measures were anyway.
Actually, Lucy, can I address it? Because I think the spirit of your question is the right one. Like, when you are in a situation like we were in March of 2020, there's this scary new disease coming out. And we live in the West, where the infectious disease has been conquered, right? I mean, we built into our hindbrains this like fear of infectious disease, but infectious disease is something that happens to other people in faraway places. Or HIV, it happens to people not like us or something. And so you have this new disease that comes, all of a sudden everyone's threatened by it. Our primal instinct is to fear it and to shun other people, because we get infectious disease by interacting with other people, right? Part of the job of public health is to manage that fear, not to stoke it. And it's by stoking that fear that we came to this response that it was a moral imperative to suppress dissent. because if you're scared, you can't have someone dissenting. That's a threat to the entire community. But in fact, that kind of dissent, when you have this kind of uncertainty, is absolutely essential to learn what the truth is. Like the dissenters are often, sometimes they're right, sometimes they're wrong. The issue is not like the substance of the dissent. The scientific process involves arguments between people that are structured by and tempered by data analysis. And you have to have that happen, especially in an emergency. That process can't be shortcut. The role of public health in that setting, the moral role would have been to tamp the fear down as best they could, be honest about what was known and not known, and then allow the science to develop as rapidly as they possibly could.
Why do you think that it was that the public health needed to calm the fear? Why is that responsible?
I mean, I think the fear leads to bad decision making.
Yeah.
It leads to stigmatization of people with the disease.
Yeah.
It leads to all kinds of terrible social consequences and also bad health consequences. It causes the kind of anxiety that we've seen characterize much of the public during the pandemic. It itself causes health problems.
Yeah.
And I think it basically makes it impossible to have a rational discussion about what the right policy is, as we've seen.
Yeah.
There's a reason why I thought that was a basic principle of public health. You don't stoke fear. You calm fear, provide people with tools to address the fear, and then be very, very honest about what's known and not known. Right?
And where was that done? Probably Sweden.
Yeah, Sweden.
Yeah, which they followed the original pandemic plan, which is to educate, advise, support.
But let me put it another way. Like, if that kind of plan, that old plan, it trusts the public.
Yeah.
And then the public then responds by trusting public health. It's a virtuous cycle. Instead, what happened is we have a public health that distrusted the public, decided it needed to manipulate the public. And it's now turned around, so shocked and surprised that the public now distrusts public health.
And what do you think is the legacy of that? We talked before about vaccines. We've also seen that people aren't going back to work, so we've got a problem now. We've got a rail strike on today and people are working from home and we haven't got enough, the passengers, there's a sort of, less passengers. What is the legacy of not trusting your public and manipulating them? Do you think?
I mean, the lack of trust in public health is an absolute disaster, right? So a lot of the quite important things that public health does requires the public to trust it. Right. So, for instance,
do you think people have lost trust in public health?
I think so. I've lost trust in public health. I think so. For instance, the evidence that childhood vaccinations, polio, diphtheria, measles, those are incredibly important vaccines. I mean, I look at the evidence of what happens when we slip even a little bit on it, and it's just a disaster for children.
But why are people not getting their vaccines? Because
they don't trust public health. So I can read the literature and decide for myself whether it makes sense. I think it makes complete sense. On the other hand,
so there is a shortfall in those people taking up those schedules.
Yes.
And is that partly because of the idea that we'd vaccinate young children against COVID?
I think it's just a general loss of trust in public health that causes some people to say, well, if I don't trust you on this, why should I trust you on anything else?
Yeah.
And I think there is also this push toward, like the promise of the vaccine was it'll prevent you from getting the disease. That's the implicit promise that was made when the vaccine was
Were you aware
rolled out.
that it might not do that at the time? From looking at the data,
the data in the trials.
The trial data was much more confident, wasn't it?
No, so it's interesting. So the trial data had as a clinical endpoint, it had the prevention of symptomatic infection. Now, that is not the same thing as prevention of infection, right? It's not the same thing as prevention of transmission. It could have had prevention of infection and transmission as an endpoint, but it was easier to run a trial where they say, okay, if you have symptoms, then we'll test you. And then you can say, okay, prevented symptomatic infection, which it did for about 4 months that the trial ran. But in order to check whether it prevented all infection, then they would have had to regularly test everyone in the trial repeatedly, even when they're asymptomatic, right? And then they would have to do contact tracing continually to see if people who in contact. It would have been a lot more costly trial. But it also would have given us the key piece of information, which is, can this vaccine be used to stop disease spread? The trial didn't give us that information. It just gave us that it prevented symptomatic infection. It also didn't give us another key piece of information, which is, does it stop you from dying? Because there wasn't sufficiently large number of old people in the trials to actually answer that question. So I looked at the trial evidence and I thought, okay, if it stops symptomatic infection, it probably stops you from dying. And so Sunetra, Gupta, and I, we wrote an op-ed in December of 2020 arguing that what we should do is we should use this vaccine for focused protection.
Yeah.
Use it to protect the old. There's still uncertainties about the vaccine, but on net, you're protecting older people against a very, very strict, severe disease. And so if you protect against that, you can have some uncertainty about the safety of the vaccine.
Which is what they did when they rolled it out. They used
they prioritized the old, right?
Sort of focus.
They used the Great Barrington Declaration principle. But then it turned into this. The rhetoric around it wasn't the Great Barrington Declaration. The rhetoric was, we're going to use this to get rid of the disease.
Yeah.
And so that means we need, the World Health Organization changed its definition of herd immunity to say 80% of people are vaccinated, or some large number of fraction of the people vaccinated, that's herd immunity. Premised on the idea that the vaccine stops disease spread. But they didn't know that it stopped disease spread. And in fact, it doesn't stop disease spread. After 2, 3 months, 4 months of getting fully vaccinated, the protection against getting infected drops very sharp. I got vaccinated in April of 2021. And in August of 2021, I got Delta. Here and then Omicron came across, and now everyone sees the vaccine does not stop disease spread. It should never have been used for that purpose unless we knew for certain that it was going to do that. And now, as a result, people have lost trust in public health.
Yeah. So why do you think the World Health Organization even got it? I mean, are they given information by people who may not have as much depth of knowledge, or what's going wrong?
It was, you have one randomized trial. It has the wrong clinical endpoint.
Yeah, and then the whole thing.
So you have to make a bet. You have to make a guess. Like the epidemiologically meaningful clinical endpoints would have been stopping disease transmission. Then you can use it for herd immunity, or protection against severe disease. Then you can use it for focused protection. We had a clinical endpoint that left uncertainty, and they made the wrong bet.
Yeah. So in winter, do you fear that we may be reintroducing restrictions for COVID and flu? We haven't really organised ourselves in a way, we haven't come to terms with the disease or learnt how to deal with it. We just tried to lock down and lock down. So what do you fear about this winter?
Well, the disease is here to stay. It's not ever going away. There's going to be wave after wave after wave. The population, though, is not the immune-naive population that existed in January 2020. A very large fraction of the population has had the disease and recovered from it. A very large fraction of the population in the UK and many other developed countries have had the vaccine, and thus have protection against severe disease. So the disease will come. People will get infected. And some people will get sick and die, but a much smaller fraction than died from the disease in January. It will cease to cause the fear that it once did because of that fact. Essentially, herd immunity.
But people are calling for restrictions for winter now. ICAGE
has been calling for restrictions the whole time, but I don't think very many people are listening to them nowadays.
No, I think you're about right. So, I mean, New Zealand clearly didn't get away with it. They've still got infections now, but they rode the wave. They didn't have the number of deaths that have been seen elsewhere, and couldn't you say that's a really good thing? And they waited. They've now got the vaccine, so when they do see their infection cases rise, they've got protection.
Yeah.
And
so Australia and New Zealand, Taiwan, a few other places.
Yeah.
Like they're united by a few things. So one is. In January 2020, the disease, it was clearly almost everywhere. Like it was found in Iran, it was found in Italy in late January. The United States, I think the official start date is January 23rd. The disease had spread very, very widely. But it hadn't spread, I think, very widely in New Zealand and Australia and a few other places at the time. And so they had very few cases. Australia and New Zealand in particular, they're in the southern hemisphere, right? So the disease seems to have a particular proclivity for the winter.
But we don't know how many cases we had in the UK in January 2020, and I think antibody surveys since found that the people that claimed to have had some awful thing in December it wasn't COVID at all. So what people have argued that we could have bought time then to prepare.
I don't think so. So I did a study in early April of 2020 in LA County and Santa Clara County. Two different studies. Around 3% prevalence in LA County, in Santa Clara County, 4% prevalence. That doesn't sound like a big number, but it was 50 times more infections than cases. And to get to 3%, that means it was here in the United States anyways, in like certainly at least December, might have been November of 2019. And there was a study done of antibodies in stored blood in I think it was Bergamo in northern Italy.
Yeah.
From September 2019, they found antibodies.
Amazing.
So I think the disease had spread from now. But on the other hand,
do we know it even came from Wuhan?
It almost certainly came from Wuhan, but I don't. We don't know. But I don't know with any certainty. Because the biggest outbreak was in Wuhan at the beginning, right? So that it follows the spread,
already been
right?
moving.
Yeah.
So we don't. Yeah. Okay.
So New Zealand and Australia, they shut down early. They're in the southern hemisphere. It doesn't spread that efficiently in their summer, our winter, and I think they actually got rid of the disease for the most part with their very, very, very early lockdown. For us, it was not possible to do such an early lockdown. The early lockdown would have meant November of 2019 or October of 2019. But for them, it turned that success turned the islands into a prison, right? So if you were an expat, you couldn't go home to bury your father or your mother. You had to sit in quarantine. There was a lottery. Even if you were a citizen of the country, you couldn't go back home. They had lockdown after lockdown after lockdown. Every time there was a single case found, they would lock down the community. Like 10 lockdowns. I lost count of the number of lockdowns New Zealand had. And the policy itself was premised on the development of a vaccine, essentially as a key out of the prison. But that vaccine could not, in principle, have been developed and tested. It could not have been tested in New Zealand because you needed cases in order to test the vaccine. So they were relying on the suffering of other nations in order to free them from the prison that they were in. It's not a policy that's exportable. I'm glad for the people in New Zealand that they didn't have to suffer nearly as much as many places from COVID because they had the vaccine available when they opened up. But I don't think it's an admirable policy in that in a sense of like
we had to do a lot more than that. Right? Trials of drugs and the rest of the world had to kind of go through it while they kind of like the Zoom
classes. They still had lockdowns. And New Zealand and Australia, they still had school closures. So they paid the price for their policy, their success with COVID. In the form of lockdown harms and in the form of the sort of like immoral, unexportable policy.
Yeah. Some people might say it's worth it because every death is, every life is sacred, and that I suppose was another thing that politicians like to say. Every life is,
every life
sacred.
Is sacred.
You have to balance harms, and we can't. We've got finite resources.
I think you can't look at that policy and say, well, okay, the UK should adopt it. Right? That the UK didn't have that option available to it. The disease was here too early for a lockdown of that sort to actually have stopped the disease from spreading sufficiently.
People were stopped from visiting, and we had a series of, and America did too, that whenever we thought there might be a new variant or a new variant was discovered and it was deemed more transmissible or more deadly, whatever that means, we locked down borders, and our government was actually criticised for not locking down borders early enough. There are still travel restrictions. Were they relevant then, and are they now?
Yeah, I think there was a big brouhaha in late January or 2020 in the United States around shutting down travel to China, or shutting down travel to Europe, right? It was too late. Right, so travel restrictions are useful as a public health tool if you have one place where the disease is, and a whole bunch of other places where the disease isn't. You stop travel from the place where it is to the places where it isn't, and the disease is restricted from spreading. The disease was already everywhere. in January 2020, or nearly everywhere in January 2020. It was too late for travel restrictions to have any meaningful effect. And to have continuing travel restrictions on vaccination status, it's just discriminatory. Vaccine doesn't stop transmission. A vaccinated person is not more clean than an unvaccinated person, especially one who's already recovered from COVID.
Doesn't it reduce your risk of transmitting the disease? And they were just trying to do everything they could to
I mean, it spreads so easily, right? So okay, so you save, but you're not actually protecting any particular individual. What you're just saying, okay, we're going to have the disease start spreading 10 days later than earlier. You're not actually. It's flattening the curve, not getting rid of the area under the curve. The area under the curve has its sway.
Yeah, has its sway, and so even that would apply to testing.
Yeah, I mean, I think testing, is a useful thing for focus protection, right? So in nursing homes, it's very important that you don't let people who enter with the disease. Testing is really important because you have vulnerable people there. In multi-generational homes, we talked about earlier, maybe you give lots of tests to grandsons and grandchildren to check themselves before they go home to visit grandma. I mean, I think testing could be useful, but the way we used it, it was essentially a way to implement lockdown by stealth, right? So like asymptomatically testing children before they go to school, and then keeping them out of school if they have no symptoms at all for 5, 10 longer days, essentially as a way of shutting down schools for those kids, with very little gain as far as controlling disease spread. You have to look at these tools. They're not good or bad in themselves. They're useful for certain things and not useful for other things. And we just decided that we're going to use them in blanket ways to assuage anxieties as opposed to focus protection.
So do you think the money side of it, there has been this huge big business in testing, big business in vaccines, and big business in drugs and in tech. Do you think that has been a dominant feature of the way we've run this pandemic as opposed to the original ideals of public health?
Yeah, we've created billionaires. I call it the COVID industrial complex. I mean, we basically have created an interest group to keep the pandemic going, right? The testing, the passports, the scanning, all of this is created a huge industry, and their argument is, oh, we're keeping people safe, when in fact what they're doing is just keeping the anxiety going. Yeah. Again, they're not bad people. They're not the technologies themselves might be useful, but if they have to be put to useful uses, identify who's vulnerable, use the technology to protect those people, use it to guide clinical therapy, for instance. But to use it to shut the world down, which is effectively the way that it's being used, is a mistake.
Yeah. So you would ban all travel restrictions like that? It's not really helping?
I don't see any purpose in it at all right now.
It's like it becomes entrenched, I suppose, like we have at airports now, checking every single thing for a little bit of water. Just because of the 9/11, these things do become entrenched, and I suppose this may be another thing to become another.
We have to work really hard against that. I mean, there's no, like, it's okay. It's low enough cost that I have to take my shoes off before I go enter an airplane. But it's to make it so that any child at any time, just because they happen to have a positive test on whether it's false positive or false or not, were exposed to someone who had a positive test, even though they had no symptoms, 5 days or 10 days out of school, or you have these travel restrictions where like families go abroad and they can't come home because one person tests positive, and now they have to quarantine for like 10 days in a foreign country. People just it's too costly for the benefit. So because I don't think that actually saves any lives.
No. And that's the point, really. Yeah. That's what we were trying to do. I know in America they were still masking toddlers, weren't they, up till recently?
There's still places, I think. I mean, I think New York just lifted masking toddlers, 2 to 2-year-olds. I mean, it's crazy. The World Health Organization doesn't recommend it. The European CDC doesn't recommend masking toddlers. And just think about it. How many lives were saved by masking toddlers? I mean, in order for a mask to work, you have to have a tight seal. You can't. I mean, a toddler might stick their tongue out and make it wet. I mean, the whole thing is nuts.
I think that's a good place to end. Do you?